Thank you, Dr. Sharma, for this kind invitation. And it's an honor to speak at your university. And let me give you a short introduction. My name is Dr. Vijay Vaishnav. I have been the head of the Department of Homeopathic Materia Medica at CMP Homeopathic College in Mumbai. And I was teaching there for 25 years. The last 12 years, I have been now in the USA, where I'm practicing in California. And I have three clinics in three different cities here in the San Francisco region. I'm also associated with the California Homeopathic Medical Society, where I'm on the board of directors. This is the oldest society, sir, in the USA. It was founded in 1877. It's the oldest homeopathic society, and it's an honor to be also involved with that society where we work and we have regular conferences and we have lots of interactions with other homeopaths all over the country. And I have also been, apart from teaching at the Homeopathic College in Mumbai, I was a member of the American Homeopathic Medical College in Arizona and Phoenix, and the Caduceus Institute of Classical Homeopathy. So, just a very short introduction. I would like to start with my session. I'm going to present slides. Are you able to see?
No, sir, not yet. It is.
Not yet?
Yes, sir. Now we can see.
Can you see it?
Yes,
Yeah,
sir.
yeah.
Okay. So, I'm going to talk about the role of homeopathy in treating pathological cases. I was told by Dean Professor Sharma sir that a lot of students are also going to be attending, and of course, apart from faculty and other homeopaths from other parts of the country and the world. And because I'm also going to talk to students, this session is mainly to encourage our homeopathic students and freshly passed homeopathic doctors to have confidence in themselves and to be able to take up challenges. That is why these cases that I'm presenting today are cases that I had seen when I had just started my practice. So it was many, many years ago, since 1985, 86, 87. That's the time when I had seen some of these cases and I preserved them with the hope that it might be of some use and inspiration to the new generation of homeopaths. So the first case I'm going to talk about is an acute condition. So today I'm going to talk about one acute condition where there's a pathological problem where homeopathy can work. I'm going to talk about a constitutional treatment for another case. And then I'm going to talk about one case where a specific remedy was given. So three different types of cases, three different ways in which you can use or you can apply your knowledge of materia medica in prescribing. So this is a boy who was around 17 years old. He came to my clinic and he actually collapsed in the clinic. He was a known case of bronchial asthma and he had been taking treatment from a lot of doctors. But the past 6 months, he had started homeopathy and he was coming to me regularly for the treatment of his asthma. He was appearing for his 12th standard exam and he had not been eating well. At the same time, he had been very anxious. So his parents felt that some of his breathing issues are because of anxiety. But when he came to the clinic with his older brother, he actually could not even speak and he almost fainted in the clinic. When I examined him, and I used to teach, initially I used to teach clinical medicine and I used to teach internal medicine. I used to attend the KEM hospital in Mumbai, which is one of the biggest hospitals, allopathic hospitals, with the medicine department. I used to take rounds with the head of the department. So I was doing a lot of medicine work as well as homeopathic materia medica and therapeutics in our college. So this child was brought, and when I examined him, I found that all over the areas in his neck region, there was a lot of crepitation. That means air had escaped from his lungs into his subcutaneous tissues. So I immediately sent him for an X-ray to the local radiologist, and he came back with a note saying, "Dr. Vaishnav, I confirm your diagnosis that this is a case of surgical emphysema, and it looks like a bullous emphysematous bulla in the lung." He had emphysema, so the lung tissues had become very thin. The alveoli had become so thin that one of them burst open, and air entered the mediastinum, and then it rushed out and went into the neck region. So let me show you the X-rays. So in February, on 17th of Feb 1989, so it's a long time ago, I was just freshly out of the college, and I was teaching at the homeopathic college at that time. So you can see that there's a lot of change in the appearance here. This is where air had filled up, because somewhere in the lung, the bulla had ruptured and air had entered the mediastinum, and it had gone into the subcutaneous tissue in the neck region. He could not move his neck. The slightest movements were painful, and uh, we decided to admit him in our homeopathic hospital. And I called up the surgeon, the ENT surgeon, and said, "I'm admitting this student, this child. There might be a possibility we might have to do a tracheostomy if he cannot breathe well. But we would first want to give priority to homeopathy and treat him with homeopathic medicines." Now, in this acute state where he was, slightest movement aggravated him, he had shallow, rapid breathing, he had stitching pains in the chest region. With every breath, he used to get pain. And the fact that he was extremely thirsty, we decided to start with bryonia for him. And while he was admitted, he was kept nil by mouth for the next 24 hours in case he needed emergency surgery. So we were ready that there might be a need for surgery, but we said we will first try homeopathy. Now, 3 days later, the patient's X-ray was repeated, and we found that quite a bit of the air had started getting absorbed, and he had become asymptomatic. He was able to move his neck, he was able to breathe better, and in general, his condition continued to improve. And then on the 24th of February, as you can see here in the last, all the air has got absorbed. So these are all positives of the X-rays. They are not the negatives, but the actual positives. So when the printer made this, it was also published in one of the journals. He made a positive out of it. So you can see that now this line is gone and all the air got absorbed. Now this patient's father was working with the Indian Airlines. He was a general manager. So he decided that he would like to take a second opinion. And after we discharged him on the 25th of February, he went to one of the chest specialists in Mumbai and said, "This is what happened to my son." And the doctor says, "I don't believe it, because with allopathic treatment, it would have taken at least 2 or 3 weeks for him to recover. And I can't believe that in 7 days, your child has become perfectly normal and he has recovered completely." So this is a very simple example of an acute condition where there was a pathology, there was a rupture of the alveolus in the lung, which caused air to escape into the mediastinum and also into the subcutaneous space. So under the skin, everywhere you touch him, it was like crackling. And just simple bryonia took care of it. This person also was on IV fluids for a few days because we didn't want to give him orally anything in case he needed surgery. And he developed thrombophlebitis. So after, when we discharged him, we decided again not to give any local applications like what you get in the allopathic field, thrombophob, or anything that would help reduce the venous thrombosis. But we decided to give him hemamelis. Hemamelis is the aconite of the veins. So it is useful for any acute inflammation in the veins. And in this case, it was post-trauma. The needle had caused inflammation and he had developed thrombophlebitis. And so again, a simple pathology in the vein we took care of with just plain homeopathy, and that too internally without any external applications. So this brings us to aphorism 2, where the highest ideal of cure is rapid, gentle, in the short, in the shortest, most reliable, and most harmless way. And that is exactly what we achieved in this acute case. It was rapid. Even the allopathic physician was surprised that in 7 days he recovered completely, and it was quite reliable because we are able to give him the result. Gentle because we did not have to do anything like push in a needle or a tube and get the air out. And there was, of course, no side effect of the homeopathic remedy. In fact, the side effect of the IV fluid in the injection also we treated with giving him hamamelis. Now, there's another case that I would like to talk about, which was again a surgical case. This was when I was a registrar in the hospital, and our principal, Dr. Anil Bhatia, who was also the superintendent of the hospital. He got this patient in the OPD, in the outpatient department, with acute intestinal obstruction. Basically, what happened was that he had a perforated ulcer, and after that, everything stopped. So it was an adynamic obstruction. And he had severe pain in the abdomen. So Dr. Bhatia asked for an X-ray of the abdomen in a standing position, and it showed air under both the domes of the diaphragm, which means that there was a rupture, there was a perforation somewhere, and air had entered from the intestinal tract into the peritoneal cavity. Now, on the basis of one keynote symptom, so this is the use of keynotes, he gave Refanus to this patient. The patient said that, doctor, I'm trying my best to burp. I'm trying my best to pass gas from below, but nothing is coming from above or below, and I'm feeling so full and I'm feeling so distended. I cannot bear this. So, on the basis of this acute pathological condition, once again, the surgeon was informed that we might need his help in case we need to take care of the perforation. But just simple Refanus 30 potency was given to this patient, and the indication was tympanic hard abdomen, no flatus emitted upward or downward, griping about navel, pad-like swelling of the intestines, and vomiting of fecal matter. When you have vomiting of fecal matter, it means there is intestinal obstruction. So this is another case which I would like you to look at, and I would like you to study this remedy, because this is a condition that sometimes can happen, and what I would call these as pseudo-surgical conditions. For a surgeon, the first thing they will do is they'll open up and they will try to stitch that part or repair it. But for some of the homeopathic doctors who are experienced, this is pseudo-surgical. They can treat with homeopathy, and we also made sure that the surgeon was available on standby in case of the need for surgery. He would go ahead and operate and make sure that the patient doesn't suffer because of the homeopath's neglect. So we made sure that we had every infrastructure available, but we treated him with homeopathy. So these were the cases that I saw. The Refanus patient was when I was a registrar, and this Brianna child with the subcutaneous emphysema was in the first few years of my homeopathic practice. So I was a very freshly passed doctor. I was teaching at the homeopathic college, and at the same time I was also seeing patients privately in my clinic. Now let's talk about a constitutional remedy. Deep vein thrombosis. This is a condition that can occur in many patients. It could be after injury, it could be after a long flight, when you're sitting for a long time and you're not making any movement. You could cause the blood in the veins to get thrombosed or clot, and that causes a problem. So this was a patient who was very young, 34 years old patient, and he was admitted into one of the top hospitals in Mumbai. He was one of my students' uncle, actually his older cousin, but he was almost the age of her uncle, because she was, I think, around 18 or something, and he was 34. So he had this pain and redness in the calf region in 1995. This gradually went on increasing, and he had already been treated with anticoagulants. But then there was a time when he got severe pain in the left thigh, and it spread all the way down to his foot. So, because of that, he was admitted in the hospital in 1997. As I'm told you before, I'm purposely showing you cases which are many years ago, mainly because I want you to realize that even if you're a junior homeopath, you should be able to have the confidence to treat cases and use these examples as an inspiration to work harder and make sure that you do not fail homeopathy. And because of you, the patient can get a better quality of life. So the color Doppler was done, and it showed deep vein thrombosis of the left external iliac, posterior tibial, and the other veins of the lower limb. Now, if you look at this color Doppler studies, you see that there are two different colors coming in here. That means the flow is in the backward direction. Out here also you see they're not in the same direction, but it's because of the fact that there is now uh, the valves are not patent, and that's leading to some amount of reflux in the veins. This is the report that we got. The left common femoral vein indicating the presence of a fresh thrombus, and there is a thrombus in the superficial femoral vein, popliteal vein, and the anterior and posterior tibial vein. That means the whole of the left lower limb had got thrombosed. Almost all the major veins of the left lower limb were thrombosed. So the opinion was extensive deep vein thrombosis in the left lower limb. Now, apart from this deep vein thrombosis, there was something else that was there in his pathology in the background. He had a degeneration of the hip and the vertebrae, and an MRI of the spine had shown a left lateral herniation at the L3, L4 level, and posterior and lateral herniation at the L4 and L5 level, and again at L5, S1. And there were arthropathies. That means there was degenerations of the joints between the vertebrae at L4 and L5. So you see there's a lot of degeneration occurring here. There's some amount of osteoarthritis, some amount of disc prolapse. He also had become very irritable. So apart from this, we also found that mentally he had become very irritable, and he was afraid that because of this condition now, he will never be able to walk again. And if he cannot walk again, he will never be able to earn a living. He had his own business, and he felt that he will fail in his business. He will become very poor. He will not be able to afford even the simple necessities of his life. He also had on examination, apart from the straight leg raising test, which was positive, that means there was some amount of involvement of the spine. We saw that the tongue was cracked and fissured. In the family history, we found that there was a very strong syphilitic miasm in the background, in the influence. And finally, he had come to us with this deep vein thrombosis and the degeneration of the disc in the vertebrae and the hips. We gave him calcarea floor. Calcarea floor is a very important remedy for venous involvement. Calcarea floor is also a very important remedy for growths in the bones, for degeneration, for osteophytes, for arthritis. So the remedy that we thought for him, and also we found there's this fear of poverty. He was worried that he's going to become poor and he won't have any money left. So on the basis of this background and the pathology that he was presenting with, we gave him calcarea floor in the 30 potency. This was repeated quite frequently, and we asked him to get the color Doppler studies done at least once every month. He was also following up with a surgeon who was handling him. Of course, he was not being given anything else because they had given all the medicines for thrombosis and there had been no effect. And they were considering finally operation to see if they can get rid of the whole clot. But that was going to be a very prolonged and possibly a dangerous surgery. And that's why they turned towards homeopathy for us for this. Now you can look at the slides. If you compare it with the previous ones, you see that everything is either red or everything is blue. There are just a few spots where there is some reflux happening, but otherwise you see that it's completely unidirectional flow. It's all in one direction with no change in the colors. If you compare it with the previous one here, you can see that the colors, there are different colors coming up because of the fact that there is bidirectional flow and there is a reflux that is occurring. So this patient's final color Doppler showed complete recanalization in the previously reported thrombosis involving the left leg veins. He was completely on homeopathy. And the posterior tibial vein is also completely recanalized. So without the use of thrombolytic drugs, without getting any surgery done, we were able to help this person recover completely. And he went back home walking with no major complications at all. At the same time, his backache also recovered completely. So this remedy worked at the constitutional level. It helped with his emotional state. It helped with the pathology. And it took care of both the arthritis in the joint or the degeneration of the lumbosacral region, as well as the deep vein thrombosis. This is another very interesting case. This boy actually came to my OPD straight from the railway station. He came from Uttar Pradesh and he was brought with a history of convulsions for the past 2 years. He also came with a CT scan, which helped us, which had the diagnosis very clearly mentioned. But these conversions were coming about once in 4 or 5 months. Sometimes his eyes used to roll up. There would be frothing at the mouth. He was restless and unconscious. Usually these occurred in his sleep, and each episode was followed by fever and vomiting. So fever and vomiting were also a part of his convulsions. Now, occurring during sleep, you would think of drugs like Bufo. There are many other remedies, but there was something else much more important on which we made this prescription. So with the fever, with the seizure, he would have a headache. The seizure would last for only 4 to 5 minutes. There were no auras. So when there is no aura, you might find that it's not going to be easy for you to find the remedies, because almost all our remedies like cuprum, etc., have some aura, and this patient had no aura. His last episode was on July 1, 2008. When we examined him, everything was normal. His CNS was normal, higher functions were normal, his tendon reflexes were 2+, that means normal. His plantars were flexors, so there was no major degeneration of the CNS, or at least the spinal cord and the reflex tissue. Now, this is the CT scan that he came with. And if you look at the CT scan, in the frontal region, you see this circular spot. And there is a lot of edema surrounding that. Now this, I'll show you another, which is a close-up. So this is a sort of a granuloma that he had. And the commonest granuloma that you can get mainly in India is tubercular granuloma. And his report also said there's a conglomerate ring enhancing lesion in the left frontal cortical region with associated perilesional edema simulating inflammatory granuloma, and the radiological possibilities are tuberculoma and neurocysticercosis. Now, we asked about his history of non-vegetarian food, and that was ruled out. And we found that he had also been seen by a neurologist in the past who had confirmed that this was a case of tuberculoma. So there was a tubercular lesion in the brain which was causing these uh, seizures. The homeopathic remedy that we gave him was iodoform. So now we are given a specific remedy. The first case was an acute remedy. The second case, where there was a major pathology, there were two pathologies, we gave a constitutional remedy. And here we have an even more dangerous condition to deal with, where a rare remedy called iodoform was given to him. Now, I just want at least the students to realize that there is nothing like a rare remedy. A rare remedy is rare only because you do not know about it. The very fact that it is mentioned and it has been proved by somebody means it is a remedy that is important. So every remedy has its own importance. Nothing is rare, nothing is very common. If it is rare, it is because you have not read it, but it is always important to remember that you must keep reading your homeopathic materia medica every day. When I was a resident in my hospital for almost 2 years. Every night, I would either read Boric, or I would read Clark's Dictionary of Practical Materia Medica, or I would read Farrington. I would spend at least 1 hour at night, more like a bedtime story. Read, read, and read. That is the only way you will find that you can improve your knowledge of the Materia Medica, and then you can apply it very well in practice. So, what is iodoform? Iodoform is a remedy that should not be forgotten in the treatment of tubercular meningitis. There is sleep which is interrupted by sighs and cries, and the patient is very drowsy. This reminds you of apis. It also reminds you of Helleborus, where there might be a shrill, piercing cry. But in those conditions, there is more of encephalitis caused by other conditions, or there might be some amount of hydrocephalus. But here we are dealing with a person who has actual tuberculosis. The pupils in most of these patients are dilated, they contract unequally, or they react poorly, and sometimes they have double vision. You'll also find that in the abdomen, for example, chronic diarrhea with suspected tuberculosis. So this is a remedy which is very important for tuberculosis, but it has a specific action on the brain, and it affects the brain and the meninges. So this was a condition where iodoform was given, and now I will show you what happened to him. So we followed him almost at regular monthly intervals, and after a few months, after about 4 or 5 months, he was asymptomatic. He had not had a seizure. Usually at least once in 3 to 5 months he would get a seizure. He decided that he would now like to go back home to his hometown in Uttar Pradesh. So we decided, let's get his CT scan done. If his CT scan shows some positive changes, then we can let him go. We also found that his weight had increased. He was gaining weight. There was a general sense of well-being, and there were no fevers, no seizures ever since he started on homeopathy. He was not on any anti-cox treatment. We had not given him any allopathic treatment for his tuberculosis. He was only on homeopathy, and he was under our observation. They were living in some rest house, and they used to keep coming regularly for their follow-up treatment. Now here is the CT scan of the same patient, and you can see that there's just a small scar that you can just barely visualize in some of the scans. You can see that just a small calcified spot. You must remember that usually tuberculosis always heals with calcification. So that big ring enhancement, you can see there's no edema now around the tissue in the brain, and it all that was remaining was a small spot of calcification, which was a scar caused by the tuberculosis. So this is another condition which was otherwise a pathological state, where only homeopathy was given and the patient recovered completely. We could let him go back home, and that took care of it. No anticox treatment and no recurrence of his tubercular meningitis. Now, this again, I was uh, made aware of this remedy mainly because, again, our principal, Dr. Anil Bhatia, had treated one child who was brought from a leading hospital in Mumbai. She was brought in a stretcher, and she had been diagnosed with tubercular meningitis. She had not responded to the usual anti-TB treatment that the allopaths had given. And they decided that now it is not worth it keeping her there. They were just paying a lot of money to the hospital without any actual help to the child. She was, I think, about 8 or 9 years old, and she was brought to our hospital. She was almost unconscious, and the parents had a lot of high hopes because they had heard a lot about homeopathy and especially about our principal. And he gave iodoform to this child. He had given iodoform in 30 potency. So I learned from him because I was a registrar in the hospital. I was seeing that child every day. I was monitoring that child's progress. And I'm sure you won't believe it because I did not believe it when 1 month later she walked back home, completely conscious, with no post residual, any paralysis or any neurological deficit. She walked back home with complete normal intellect, with no damage to the brain, no damage to the peripheral nerves, and that was the response to iodoform. So always learn, always try to pick up things that you see from that others have treated, and use that, keep that in your memory, and use that always in the future. So as you can see in this case, the CT scan of the head shows no evidence of any abnormal area of altered attenuations is seen in the supra or infratentorial compartment of the brain. Conclusion: this is a normal study. So this is basically the scope of homeopathy in pathology. You of course must be aware of what are the what is the scope and what is the limitation of homeopathy. You cannot treat everything, but if you have a good infrastructure and if you have good confidence and good knowledge and you have really been working hard, you should be able to take up such challenging cases and get a positive response. I think I have reached
Thank
my
you, sir. Yes,
minutes.
sir. Thank you,
So
sir, for sharing wonderful cases. And